Home health speech therapy has grown a lot in the past few years. The nation's population is getting older, and insurance reimbursement changes encourage physicians to refer their patients to home health rather than other settings. I work in home health. When I first got started, I didn't know what I was getting into. I didn't know anyone who worked in home health, and there were only a few resources online. But despite my ignorance, I took the chance to take a position in the field, and I'm glad I did. One question I get a lot is, how does home health even work? What does a day look like? Check your visit list. It will change a little since new assessments can be added on and some patients may get sick and will be taken off. Nevertheless, review the entire week's worth of patients. In home health speech therapy, this usually means fewer than 35 visits. And of these visits, you may see a patient 2 times, so you'll likely have fewer than 20 patients. Group your patients together by location. Your company should have an option to plot out all the visits so you can see where your patients live in relation to one another. For the patients you see twice a week, you typically will set them for a Monday and Wednesday or a Tuesday and Thursday. I typically keep my Fridays open for new assessments or patients who don't live close to anyone else or other kinds of visits. Prioritize those patients who have multiple visits per week, those who are at a higher risk for aspiration, those who have a hard time communicating those basic wants and needs, and assessments where you suspect severe deficits. When you have a general idea of who you'll see each day, call your Monday patients. Calls are brief, usually less than a minute long. Here's a script for your new patients. Hello, my name is Chung. I'm a speech therapist with XYZ Home Health. I would like to come over for a speech therapy evaluation tomorrow at 10 a.m. How does 10 a.m. tomorrow work for you? I will encourage you to keep it brief and set a specific time. Avoid asking what time works for them. While that flexibility is wonderful, it also makes it really hard to schedule your other patients. So give them a set time. If that time doesn't work, give another set time. If for some reason that doesn't work, you could try another day. Once you get to know your patients, many prefer that you just text them to schedule. At Adult Speech Therapy, we have almost 10 years of combined experience in home health. Check out adultspeechtherapy.co for more home health guidance and resources for you and your patients.